Business Morning. Today we're looking at investment in Nigeria's health sector with particular focus on the pharmaceutical sector, which currently, according to industry practitioners, contributes about 20% to gross domestic product. That's Nigeria's the national GDP. Well, they say that if more attention is paid to this sector, which is still grossly underutilized, it could actually transform the entire economy. Well, here to talk about that and some other issues relating to that is Mr. Sam Ohabonwa. He's a founder and former CEO of Nimet Pharmaceuticals Limited. Thank you so much, Sam, for being here.
Thank you.
I know you spent so many years in the industry. One looks at countries like China, India, and the US. They have a very big drug industry. They don't joke with it. They have tapped, they've really grown that particular sector. For us here, what is the problem?
Well, that's really a shame that an industry that globally is a major contributor to global GDP and wealth creation is undermined in our country. And it's as a result of several things. First is the structure of the industry. The Nigerian pharmaceutical industry is largely today an import-dependent industry where most of what we consume is imported, and the manufacturing contributes less than 40% of the total products consumed in the nation. You have the issue of the uncompetitiveness of local manufacture. Factors are not endowed in its favor. We have to depend on imported raw materials, and these raw materials come in at with imported inflation. And then if we have to manufacture them and re-export or manufacture them for local consumption, they compete with the rest of the products that come from everywhere in the world. Our economic system allows free entry of pharmaceutical products from all over the world. And as the good products are coming, the bad and the ugly also come. And due to apparently poor regulation in terms of preventing these deviant brands, local production is emasculated, is depreciated, and therefore we're unable to contribute significantly to GDP. I mean, let me say, you talked about 20% contribution to GDP. No, even the entire manufacturing contributes about 5% to GDP.
So it can't even be 20%.
No, not 20. Yeah, unless it's 20% contribution to total manufacturing. Oh. Yeah, the manufacturing industry component of our GDP today is about 4.5 to 5%. Yeah, yes. Pharmaceuticals may contribute. If you use 20% of the total, well, we can use that. But it's not up to 20% of GDP.
Now, you talked about the fact that a lot of the raw materials are imported into the country, and then if we have to, manufacture locally from some of the pharmaceutical companies, it will compete with the other drugs.
Yeah.
But we do have many government-owned hospitals here, and we know that bulk of the people who come there, many of them are people from perhaps the middle to the lower class, and of course, simple drugs like painkillers and some others, can actually be they are the ones who patronize, who buy these drugs. So I'm thinking, would a foreign-made painkiller compete with one that's made here? One that when you go to a general hospital, you have so many people, pregnant women, the locals coming to buy. So
there is quite a heavy level of competition from imported brands for every single manufactured products in the country, from ordinary painkillers, as you said, to antibiotics, antidiabetics. There is heavy competition. Secondly, because of the dearth of local inputs in terms of raw materials, those products that are manufactured in climes where they have local raw materials like China and India, and also with cheap labor, come cheaper. And then when you look at the infrastructure deficits which manufacturers face in our country, that is also a contribution. Beyond that, you have this problem of low research and development.
Yes, I was coming to that
in our market, which means that we have to depend again on research that is done elsewhere. And finally, low patronage. Now, if you speak about hospitals and clinics in the country, there is no preference, and that's what we've been fighting in industry, that local manufacturers should be given preferential treatment in procurement. Because the more demand stimulates supply, the more you can demand of our brands, the more we can make And lastly, also the funding issues, funding to be able to invest in R&D. R&D, it's costs a lot of money, yeah, and also the technology. We need a lot of money. These things are readily available in the developed climes, and that's why they're able to contribute more to their GDP than we do here.
Now, in terms of the raw materials, how much of that can we get here?
Well,
we have some basic drugs.
Actually, you know, Esther, you know, at some point when Nigeria was doing strategic planning, we realized that we could develop raw materials through the petrochemical industry. There was a strategic plan that was done that declared that at different points we'll move and develop different raw materials. The aromatic, the polyethylene, polysaccharides, the different chemical constituents, you know, even the development of such things as starch for pharmaceuticals, sugar. These things had been long planned, and I must give credence to those who did it. But the problem is falling short in its implementation. When we started up the linear alkaline plants and for production of benzene and a few other things in Kaduna, in Warri, those were the first steps. We were to move to the aromatic phase, and if we got to the aromatic phase, we'll have been able to produce toluene and benzene and several other solvents, diluents, and things that we import today.
So basically all of that just ground to a halt.
They did.
Said there was whose fault? Federal government, private sector?
I believe that is a combination, because we're not expecting federal government to do everything, but federal government was the one who designed the master plan.
That's the policy, created
and they were to provide the enabling environment.
Okay.
Which hasn't yet been evident, and that's why we haven't had private sector investment. And let me take it, Esther, even where people are willing to put money, because it's a large investment with long gestation period, they must be sure that they will get their money back.
Definitely.
Yeah, and if you have a situation where there is free importation of everything, and where you have the good, the bad, and ugly coming, people are wary of such climbs to put money that will be recovered long time. If it is to trade one cycle, 9 months or 1 year, they're willing to do that. But put their money for 10, 15 years with uncertain environmental situation, they are reluctant. If you take, I remember when I used to work for Pfizer way back, the plan to set up a fermentation plant that was to produce the raw materials for antibiotics. The feasibility said they had to be assured of the entire West African market for it to break even in 10 years. Now, nobody could assure us of Nigerian market, not talk of the entire West African market. So that investment didn't pass investment approval. You know, those are the kind of things that are inhibitions to our problems here.
Okay, now Sam, while we, on one hand, we still have to import raw materials. Okay, we have the challenge with that. But then on the issue of research and development, there's clearly a deficit in that area. We have universities here. We have departments of pharmacology or something. Don't we have active research going on in those departments or faculties?
Yeah, there are.
So if we can improve these drugs, and then you talked about, sorry to butt in again, you talked about the issue of the local drugs finding it difficult to compete with the international brands. So if we've stepped up on research, we put a lot into making our own local drugs, and perhaps they can also compete.
You're correct. Actually, that's where we have the competitive and comparative advantage. If we develop our own brands of pharmaceuticals, if we develop them from local flora and fauna in collaboration with universities and tertiary and other research institutes, that is the only way we can compete. And we have experience in NIMET that at some point we collaborated with some authority in University of Port Harcourt to develop a product for managing sickle cell anemia. And today is the first nutritional supplement called Cyclavit. Now, this happened because of local collaboration and the fact that having produced locally, we could now export it at our own pricing. So it's not facing the same competition we face by importing paracetamol bulk or paracetamol powder and coming to compound it into an analgesic and then trying to sell with the ones coming from China where they make the bulk. But Esther, the issue here is that to be able to do that, you need long-term funding to be able to invest in R&D. The fact that in NIMET we invested a lot in R&D affected our short-term performance, because you use money for short-term operations and you put it in long-term operation. It has a mismatch. And I believe this is what the government is elaborating, and the industry is also pushing to get long-term funding. We're working with the Bank of Industry, we're working with the federal government to provide specific long-term funding for the industry that can be used to upgrade facilities, take us to WHO compliance status, make us go into a R&D